The reason I want to talk to you about this is because I'm lucky enough to have in my contact database the phone number of one of the world's leading eye surgeons. We're lucky to have him in the city as well, at Optegra Eye Hospital. It's Mark Wevill on the show. Mark, good morning.
Good morning to you, Danny. Thank you for your flattering words.
The truest words are never flattering. They're just sincere. Thank you, Mark.
Thank you.
Let's talk about the importance of getting some vitamin D in our skin as well today. It's important, sunlight, isn't it?
Sunlight's wonderful. It's very good. It prevents short-sightedness in children. That's why in Singapore they're getting their children to go out and play. And it helps us sleep well at night, and it increases the happy hormone called serotonin in our head. So it's a good thing in moderation and done responsibly, as Matt Hancock has said. We mustn't go out and seek it. We've got to try and get it in our back gardens or our back balconies, or even at an open window if we can. Yeah,
I wasn't aware that children benefited long-term from short-term exposure whilst young to sunlight.
It's true. In Singapore, they have had huge problems with lots of children becoming short-sighted and very short-sighted. So they've mandated that children need to go out and play for an hour outside every day. And they've actually reduced the number of children with short-sightedness and the degree of short-sightedness in their children. So people need to get a bit of sunshine every day.
Wow. And it helps you sleep better, Mark.
Yes, it's wonderful. There are two hormones in our heads. One's called serotonin, which is our happy hormone, and lifts our moods and it makes us happy. And the other one's called melatonin, which is our sleepy hormone. And if we get sunlight, the happy hormone increases. It helps with our moods, and it helps the melatonin rise at night, which gives us a good sleep. If you think of Michael Jackson, he actually died because of a lack of sunlight. It does sound a bit contrary, but he's famous for avoiding sunshine and to try to sleep at night. He needed sleeping medication, and he got depressed, and he needed uppers and other drugs to help him feel happy. And as a result of that, he overdosed and he ended up dying. And all he needed really was to get into sunshine more.
Unbelievable. Can too much sunshine at a young age be counterproductive?
Well, it's yes. A lifetime exposure of too much sunshine can be a problem. It can cause cataracts, and cataracts are a cloudiness of the lens in our eyes, and it's like looking through a frosted window. And it makes headlights at night scatter the light as you're trying to drive, and it also causes misty vision. And with a simple, quick operation, 10 minutes and painless, we can have the cataracts removed, your vision improved. You can even have some clever new lenses which take away the need for glasses. And more than that, of course, you're letting more light into your eyes, and all the people who have their cataract operation operated on become happier and sleep better at night.
And that is an insertion of a replica lens.
That's right. It's a clear lens. Wonderful high-tech new lenses can do all sorts of wonderful things, and it changes people's lives.
Mark,
and
what about? Sorry,
and of course,
finish your sentence.
At this lockdown period, people aren't having their cataracts done, so we do thousands a year at Optegra, and there's going to be a backlog of hundreds of people needing this operation. When this lockdown is finished, we'll be back to improving people's vision again.
Wow. Mark, we have a couple of minutes before the midday news. What about the importance of correct eyewear? Sunglasses. You have polarized sunglasses. You have UV 400. What's all of this about, Mark?
They're good. Sunglasses are good, and they do protect the eyes. They reduce the chance of developing cataracts and things like that. But and most UV 400 lenses it's an international specification to make sure that the right ultraviolet light is being filtered out of the light, so that it doesn't cause damage to your eyes. And yes, sunglasses are very good to prevent a number of eye conditions, but specifically cataracts.
Again, going back to cataracts, lots of things affect cataracts.
Yes, they do. You need to stay off the fags and eat well, and you'll reduce the chance of cataracts. But Danny, can I briefly, before we close off, can I just tell you some of the other benefits of sunshine?
Sure.
Because, in fact, we need to get a bit of sunshine on our skins, just the right amount, not too much, not too little, because sunshine also prevents some cancers. It makes our bones strong. It prevents cancer like colon and ovarian and pancreatic cancer. It's good for acne and eczema. It reduces multiple sclerosis and heart disease. And, this will be interesting, it helps weight loss.
Wow. I notice you left that till the very end for me.
No, I've got one better than that. It boosts our immunity, and it reduces our risk of developing infections such as flu. And who knows, it might even be protecting and reducing the severity of COVID-19 in people who get out and get a little bit of sunshine today.
Wow. What's the world's finest eye surgeon doing in lockdown, Mark?
Well, I'm trying to get a bit of sun, Danny, on a beautiful day like
Have you got a nice garden, Mark?
I have a little garden, and I'm enjoying getting into and getting my legs into the sunshine. I don't think anyone wants to see my legs, but I'm going to get them in the sunshine.
Mark, it's great to catch up with you. Stay safe, my friend. Thank you.
Thank you, and you too.
Good lad. Thank you. Mark Wevill from Optegra Eye Hospital in the city centre.